BreastSCan is a project that wants to create a large-scale infrastructure of images of breast in women who have a cancer, in women that do not have a cancer, to help the early diagnosis and the risk stratification of breast cancer. What are the specific aim of AI tools in breast cancer screening? One can think that the most important is cancer detection, but it's not the only one. In my view, the holy grail of AI is not only helping radiologists to detect the cancer, but is to stratify the risk of the cancer in the female population, to do more to those women that are at higher risk and to do less to those women that are at very low risk. We are not able to do this. When you stratify the risk on the basis of a mammogram with AI, and then you do MRI only to those that are considered high risk by the AI, you have 6% of detection rate. That is a very, very high detection of cancer. On the clinical side, you have different aims. One is staging the cancer, but one of the most important clinical issues is to think at screening women who had already a breast cancer. We have 95% of survival after 5 years from the cancer, also when the cancer is in a relatively advanced stage. But we have 99% of survival when the cancer is diagnosed earlier. The point is that these women become again screened to look for the second breast cancer, to look for their wellness and their survival.
The platform of UCAME is a secure environment that provides researchers a seamless way to access the data, search for data, request the data. UCAME is a federated infrastructure and therefore is strongly focused on having a platform that can support collaboration among different researchers and entities in Europe. BreastSCan will be aligned with the technology that we have in UCAME, but it will also keep its own personality and will contribute adding more requirements and more functionality to the whole UCAME platform. We are following a similar architecture, and we are organizing the data holders with different ways. One is to have a BreastSCan reference node in which 6 of the providers will deposit their data, and that will be a secure environment connected to UCAME in which the data will be transferred from these data holders. We also have 8 additional federated nodes coming from other data holders, 6 of them at the level of the federated search and 2 of them at the level of the federated processing. So we will provide additional resources for computing at this level. We will have to extend the hyperontology and the common data model that we have in UCAME to consider the additional variables that are being defined in BreastSCan, and we have a procedure for that. And also, catalog federated search and federated processing will be considered in a similar way. One important action that has to be considered in all these projects that collaborate with UCAME is the capability of keeping the data beyond the timeline of the project. We are defining all the legal agreements with this in mind. This is very important to have from the very beginning, and therefore all the data is being collected with this consideration in mind. The technical development of BreastSCan is quite aligned with UCAME, and therefore the transition will be smooth. And also, we are considering the individual data holders can be federated nodes of the infrastructure beyond the lifetime of the project. Finally, BreastSCan is not only collecting data, it's also developing AI models to address some challenges on screening on breast cancer. These models will be incorporated to the collection of tools that will be in UCAME, and therefore it can be furtherly exploited by other projects. BreastSCan is now on a very important moment of having technical decisions and technical developments. We are leveraging all the experience that we have in UCAME. So we are now setting up the BreastSCan reference node in which the 6 data holders that want to transfer will start populating with data, and we are releasing the software for setting up the different nodes. At this moment, we also are working on the alignment of the common data model with the common data model that we have in UCAME.